you say go.
Perfect. Okay, so we just started the session. We're going to give it about a minute for folks to trickle in. We just completed Khalid Turk's session around implementing AI into the organization. And we've now got our dear friend and speaker, Elbridge Locklear. So we're going to be giving it one more minute for folks to trickle in. If you can hear me and see me, type in the chat, please. People are definitely making their way over. Great, Swathi, thank you so much. Your own fan from Summa. Great. Hey, Barry, good to see you. Hey, Rami. Okay, so hello, everyone. Liat here from Hyro. Thrilled to be your session host for the day. Thanks for joining us. If you have any questions or comments, feel free to use the chat as you are doing now. I'll be moderating that. And our speaker and dear friend today is Elbridge Locklear, SVP and Chief Information Officer at Summa Health. He'll share his expertise on staffing your digital front door with AI web assistants. So Elbridge, take it away.
All right, I'll dive right in. So happy to be here today. Excited to have the opportunity to speak with everyone. Just to talk about what we're doing at Summa. So to just kick things off, digital front door goes back to the early 2000s when the advent of smartphones, smartwatches, fitness devices, fitness apps, just to kind of bring everybody back in time. That was the time where we wanted to be more increase our engagement. Customers wanted more self-service. They wanted more control. It puts more control back in their hands, and things went kind of crazy from there. And the digital front door became one of the most important initiatives across most companies to lower costs and increase productivity. But when we think about healthcare from a digital front door perspective, it is touch points for providers and payers to better interact with patients and members. Big piece around that is to drive increased access to care. So for those to understand around healthcare, what's important from a digital front door. And another point that I'll make, and I'm sure you're very familiar with the digital front door now that we've talked about it for 1 minute or two, but earlier Ed made the comment around digital backdoor. So when we are engaging with patients receive a service, and for us, a digital backdoor would be patients that they do have a higher acuity and they need to continue to monitor their health care. They need to continue to monitor health. They want to know that someone's looking over them. They need an additional or an increased level of support. So when you think about digital backdoor, which we don't always do that, but when you think about digital backdoor, you think of hospital at home, these other type services. You think of remote patient monitoring. And then when you go down that path, you also think of, Internet of Things, wearables, blood pressure cuffs, glucometers, that smart capability or increased connectivity to those devices that allow patients to feel they're being watched over, but also give them some control back into monitoring and managing their own health. So very interesting. So just to dive into what we're doing here at Summa. So going back to after COVID, everybody was struggling with access. And access struggles came with, we didn't have enough people, didn't have enough resources, patients weren't getting health care. I joined Summa in 2021. And through that journey, we just simply could not see enough patients, but also just engaging with patients just was broken. And our digital front door, as you can see right here, would be a patient portal. Well, our patient portal was very limited. We did not have any artificial intelligence. We didn't have a chat, but we didn't have a means for patients to better engage with us when you think of omnichannel. Well, we did recognize a increase. I'm sorry, someone speak.
Just wanted to make sure we still aren't seeing your screen.
Oh, you are not. Okay.
That's okay. On the bottom, it says present.
Thank you.
Perfect.
And I think you can see it there now, right? So looking at Summa across all of our digital channels, and you can see this here in the PowerPoint patient portal. We did not have a chatbot. Our patient portal was very limited. You couldn't make payments online. You could not use very limited appointments online. We didn't have patient education. There's a lot of limitations that we had in place, but we did know that patients desired increased engagement. We went on this journey to personalize experiences with patients and also increase access across the entire continuum of care. And technology allows you to do that. As you can see here, since then, as of October 29th, 2022, we implemented Epic. That gave us that patient portal. We implemented Epic's telehealth platform. We now have the ability to schedule appointments online. We have the ability to make payments online, and not only online, but on mobile devices. But quickly following that, we also had a journey that we needed to better engage with the patients that did not have that mobile app, better engage with patients and in our community don't necessarily have computers. And there, that actual entry point to our organization has typically been our website. And what we continued our evaluation and what we discovered is that in order to increase access, we needed more people in our limited fashion. And in that environment, our call center itself was receiving 10 to 20% calls, but it was really more around information. So when patients did call, and 20% of those calls, up to 20% of those calls, were just information. So we weren't getting the calls that we needed to get so that patients could make their payment, could get patient care, could find out who the right provider is, who would take their insurance, where to go. So there was more information. And at that time, we decided to move down the path to engage with Hyro. As you see here on this page here, we engaged with Hyro right around January of 2023, earlier this year. So that's when we implemented Hyro. We implemented the original chatbot, but in the future, shortly thereafter, we implemented Spot as of June of last year. So what that does, and I guess the learnings that I would pass back to those that are on the call, just to share some specifics, since the inception and since we did implement the chatbot, what that did is drive away a very large percentage of those informational conversations so that the people that were making calls and needed to make a call was driven either from the chatbot from the website, was driven to the billing office, again, from the chatbot, so that they would actually gain access to the resources that they needed. And people that we're talking to our contact center were people that had that more complex case need, right? And I'm going to continue to talk here. So we went down that journey and we had some major accomplishments. So just some measures here I'll share with you, and then some best practices. So year to date, we've had, and year to date being the beginning of the year, we've had 55,000 open chat sessions. And what that means is someone engaged on our website and they said, well, ask the chatbot question, and they have interest in a service or a need. And so they opened it, which means they may or may not have done something, but they engaged with the chatbot at 26,000 of those open chat sessions. They actually ask a question, and out of those 26,000 chat sessions, they actually got the answers that they looked for. That's 19,000 of them. And so now that's 19,000 instances where patients are members, and ours is largely patients and partial members right now. They were actually getting answers they needed, like, if I have a headache, what should I do? If I am looking to pay my bill, where should I go? And maybe it served up a PDF or PowerPoint or a link to another website or a location so that they can go pay their bill online. It may have actually served up a provider information or contact information. So a couple of best practices that I'll rattle off that we did that we found to be very helpful for us here at Summa is, if you are going down this path where you need to increase access. Obviously, going down the path of a chatbot or artificial intelligence with Hyro using Spot, and Spot is a newer tool that is now taking advantage of the Gen AI or ChatGPT engine. You want to be more pointed in your use case. You want to be very specific in the use case that you start with. Why you want to ensure that you have adequate data, whatever that use case may be. And in our case here, we said, well, we believe we have good data on our website. Let's start with that. Let's drive and deflect calls away from the contact center for those people that are looking for information and answer their questions on the fly. So we did that. But we also have governance around that data too. So the data that's being served up to that chatbot is primarily on our website. So we have governance where we reevaluate that. I believe it's quarterly, ensuring that we have correct content, whether there's bad data, as in we may identify that from frequently asked questions that need to be updated, may identify that from the outputs of the types of questions that we're getting from a Hyro perspective, from a chatbot perspective. Then also another good practice would be narrow the scope. And for us, again, we narrowed the initial scope just to the information that we were serving up around questions on our website. We also, monitored that. So we made sure that the type of questions that the patients were asking is we focused on making sure that content was accurate. 98% as of since the deployment of Spot over the last 90 days, 98% of those questions that are being asked are being completely answered correctly. Now, I believe I have some more data to share. Okay, before we jump into that, where are we going from here? And I'll talk about the insights on the next page. So where are we going from here? From a Hyro perspective, we don't actually have the voice assist for the contact center, meaning completely deflecting all calls at the very initial phone call. And the great thing about that is Hyro has more of their voice assist, has more of that human type voice, more of a that ChatGPT enablement. It's more human-like. You might not even be able to tell that you're actually not speaking to a human, which is really good. But it can take those calls and evaluate what the patient or caller is looking for and drive that to exactly where you need to go. Maybe you need to speak to someone billing. Maybe you do need to schedule an appointment and it is a complex case. Maybe you are trying to validate pre-auth, whatever it might be, but it can direct you directly to the group of people that can answer that question versus a barrage of calls that come in that have to be triaged and taken away time from the contact center. So that's one thing we're looking at furthering. Also, the EHR integration is another big one for us as we go on this journey over the next couple of years. So going into next year, the EHR integration will be key because today, Hyro, what it does is it will serve up a link to you so that you can go download and use a MyChart mobile app to pay your bill, for example. Or it will serve up a link to a patient that's interested in paying their bill, and it would go to a link on the website. But what we will be able to do in the future is serve up that integration so that you can interact with that chatbot and pay your bill right there. You can interact with that chatbot and schedule an appointment because that information would be integrated and pulling straight from the EHR. It will know you, it will know about you, it will know what you're looking for. It's going to be exciting. And through these technology improvements, we believe that will close or start to close the gap on our continuum care with a better experience. So just to talk a little bit more about Spot and the metrics, I think I was rattling some of this off earlier. So when you look at it here, we implemented Spot, which we had the original chatbot from Hyro earlier in the year, but we implemented Spot in June. We were of the first handful, maybe 3 customers that went live. Also, We implemented their live chat session, and what happens there is where a patient may actually engage at a chatbot level and start a conversation. Depending on the type of question and their interest, we can direct them directly to an agent that will do live chat with them. It's very difficult to tell who you're talking to there, which that works out really nicely. And if you notice here, we've had, since we've gone live, we've only had 204 users connected to an agent. Now you would think, well, that's really not a lot of redirects, right? Well, actually, you want to limit that. That's actually great, because the less connections you make to an agent means that you have a higher return rate, as in the person that's asking the question, they're actually meeting their goal, they're meeting their needs, they're getting what they need. So it's exciting. A couple other things to point out from a metrics perspective. We have some canned responses or canned information available for patients, so that if, for example, from a frequently asked question or canned information that may be in our environment from a chat perspective, it serves that directly up as the text is written. And there's a fair amount of that, right? Because our content is good. But the interesting piece here is the 7%. So 7% of the time that people are engaging with the chatbot, the ChatGPT engine comes into place, which is exciting. And what it does is it takes the aggregated information and it gives a correct response. So it's not canned. That's less work for us needing to can responses, which means you need to predict and know the question. And you don't have we don't have the live chat use case information here just yet, but just another comment. There's an interesting fact here. So since we've gone live with Spot, what this tells you here in the 49 percentile and the 44 percentile that represents what I was stating earlier is canned responses are 49%, meaning you ask a very specific question, you get a very specific answer. And what we're finding is the chatbot from a ChatGPT perspective, it is actually serving up 44% of the time. And what that means is almost literally as good as the factual information that matches the exact questions, which means we're on the verge of replacing the need for canned responses and canned information, which, that limits the number of resources you need to invest in this. Okay. I think that unless someone has questions, that concludes the overall. I'm going to minimize this a little bit so I could not see questions in the chat. Okay, there we go.
I do have a question from Stefan, if you see that one, Elbridge.
Remote patient monitoring?
Yeah. So I'll just repeat the question for the attendees. Stefan was asking, what's next? You mentioned RPM at the outset. Are you focused on RPM from seniors to receive the reimbursements from CMS and improve prevention, for example?
Yeah, that is. So think about it this way. So I would say yes. The answer is yes. We're focused on doing that. We're talking about integrations and having discussions with senior leadership, as in nursing and providers, around what would it take to, and what is the priority around remote patient monitoring. We have post-acute care. We have hospital at home as a North Star. Remote patient monitoring, you've got to think about it from the perspective of, do we have some core technologies and tools? Yes. To your point, are we going to get reimbursed for that? Some of them we know for sure we can get reimbursed with right now. Today, in part, some of those higher acuity patients, it's not fully integrated. What we do is we give them a device. They come back in a week or two. To the point we were talking about earlier, is that you want to have that. I'll go back to digital backdoor, is that when that patient does go home, you want that higher level of integration, because the truth is, if you compare from a blood pressure cuff perspective, that patient's doing it already. I have a Weavings at home right now, but it's not integrated. And that is part of our next step, is to build those integrations into our EHR. So yes, we are. I can't give you, probably a tremendous number of things that we've gone live with, because the blood pressure cuff, glucometers, those integrations are on the table right now, and we have not completed those. part of the big problem around that, and sure some of you will struggle with, is the culture, the cardiologists, doctors getting on board. We have core technology right now that supports the digital front door perspective or digital back door perspective. And, it's getting the physicians on board to better utilize those. And patients are very excited. They're doing it right now. I do it myself.
Great.
I think I answered some of that question there.
Yes, Stefan, I hope that answered your question. And if you have any follow-up question, feel free to type it in the chat. I now have Dustin, Manager Digital Experience, Elbridge, for you. How does journey mapping and any other research play into your priorities and maximizing this tool?
We started at the onset of what we call is our Care 360, which falls into this realm of access. And we started with the journey mapping about a year ago. And part of that came out of it was a CRM tool, because we still need to discover more information. But also the other part of it is, from an omni-channel perspective, what are all the touch points that are out there? And the journey mapping itself, meaning walking in the life of a patient, it's a good start. I mean, we're closing the gap from a chat or from a scheduling perspective, from a mobile app perspective, but it doesn't really, the next wave of the journey mapping, it is picking those acute level patients and walking through that life of an acute level patient, because it really is different. You think about women's health, you think about patients that are on the oncology path. Their journey is a little bit different, and that we haven't started with, but we are collecting a lot of information around the CRM that we recently deployed early in the year, and I don't have a lot more information on that.
Great. Dustin, let us know if you have any follow-up question on that. And Elbridge, I've got Tonya Day asking, how are the patients and physicians adopting remote monitoring?
Well, it's interesting. I'll reference something that came out of HIMSS some time ago. So many people say that, hey, yes, and it goes back to 2018, I think, or maybe even earlier, using the artificial intelligence or using the technology to reduce the touch points, increase self-service. It's on us to do that. And I say that as in, if doctors, physicians, providers aren't adopting the technology, then they will be replaced. Well, what would they be replaced by? Replaced by physicians or providers that actually are using the technology. So the reason I reference that is, I think that's the path. And what we're seeing is doctors are pretty excited. They're pretty excited about the AI that's coming in our EHR, the AI that we're seeing on our website from a HIRO perspective, that increased engagement with patients, more real-time communications. But there's going to be that subset of providers you're still going to have problems with, and it takes time.
Great. Any other questions? Let me just look through the chat and make sure. I think I saw someone asking, how was the implementation process with HIRO, but then it disappeared. What is one thing maybe that you would have done differently looking back at the process for others to learn?
I think it still goes back, and I've still got this, I think, the slide up there right now. So I think it goes back to having a very specific use case. We started out and we felt like we want to do these 3 or 4 different use cases. When you start with that initial use case, take it all the way through the process, look at the data that's provided from HIRO. They can tell you what's working and what's not working through the tool. And I think it goes back to that, because when you try to boil the ocean, here's what happens: is you say, well, we have all these capabilities, let's turn them all on. Well, the bad thing about that from a HIRO perspective is that your end users, and I call it that, but the team that you have around patient experience, they have to be educated on how to use the tool and what the tool will do, and how to read the output output from the customers. Customers are asking these type of questions. We don't have information, or we do have information on it. We are not providing a service in this space. Let's do something about it. And that took a little time. I would say educating the team that's responsible earlier on, and narrowing that scope and taking at least one use case all the way through would be important.
Great, thanks. And with the last minute we have, since we, after this, we've got the third channel of choice, which is call center with Intermountain Health. So here we reviewed AI web assistants. The simultaneous room was with Gozio on mobile apps. And right after this is call centers. So really giving you all a deep dive into specific channels. Robert is asking, when you selected Hyro, what was the distinguishing reasons why you selected them versus the other vendors?
I've gone through the contact center vendors, vendors where you can write your own chatbot. The number of resources required to implement this is very little. High engagement from operators, very little IT work, and very human-like responses from a chatbot and voice assist type perspective. So that was very meaningful. And I've had prior experience with this. When you look at Google, if you look at, not to rat anybody out, but you look at Google and you look at your contact center systems, the chatbots they offer, they don't have a lot of background in healthcare. They're not human type responses, and they're just inadequate. You have to throw just a boatload of resources at it, and the time to value is so much longer. Hyro's so far ahead of everyone else.
Great. Well, turning yourself back on here. Thank you so much, Elbridge. You were just in time. And if anyone has any other questions, feel free to email me. You're probably getting emails from liat@hyro.ai, and we'll make sure that Elbridge shoots an answer back to you. So at this point, I'd like to let everyone out for about a 2-minute break. Feel free to visit the booths. Our partners are exhibiting virtually, and you can learn more about them by clicking booths on the top of your screen. After this, we've got Craig Richardville, Chief Digital and Information Officer over at Intermountain Health, sharing his path to success with call center automations. So thanks so much, Elbridge, and thank you, attendees, for being here today, and we'll see you at the next session.
Thank you.